Doctors in cardiology clinics have a quiet nickname for what I'm about to describe. They call it the pressure trap. Not because it's rare, but because it catches nearly everyone, including patients who do everything right. You take the pills, your pressure drops, you feel relieved. 3 months later, your doctor quietly increases the dose. Sound familiar? If it does, stay with me. Because in the next 12 minutes, I'm going to walk you through the actual physiological mechanism behind most cases of high blood pressure, and a sequence of 5 exercises that, done consistently, can help your body start regulating pressure on its own. Imagine waking up 7 days from now. No morning heaviness in the back of your head, no fog. The monitor shows 120/80. Not because you took a pill 30 minutes ago, but because your body addressed the root cause. Right now, millions of men over 50 are managing numbers, not health. They check the monitor, adjust the dose, manage side effects, and the underlying problem sits completely untouched, day after day. By the end of this video, I'll tell you the one mistake that makes this entire protocol useless, even if you follow every single step perfectly. It's not what you'd expect. Stay for that. My name is Dr. Kevin Adewale. I've worked in cardiovascular health for over 2 decades, and I want to be clear from the start. We are not here to throw away your medication. That decision belongs to your doctor. What we're doing today is addressing a physiological mechanism that most prescriptions never touch. Here's something your cardiology appointment probably never covered. Your brain weighs about 3 pounds. It makes up roughly 2% of your body weight, but it consumes 25% of all the oxygen in your body. 25%, every minute, without exception. The brain doesn't store oxygen. It needs a constant supply, delivered through blood vessels running through your neck. Arteries carry oxygenated blood up. Veins carry used blood back down. When those veins get compressed, even slightly, even partially, blood starts pooling in the brain. Oxygen delivery drops below threshold. The brain detects this immediately. What happens next is the key insight that changes how you think about blood pressure forever. The brain sends a direct signal to the heart. Increase the pressure. Force more blood through. Compensate for the restriction. Your blood pressure isn't rising because your heart is broken. In the vast majority of cases, it's rising because your brain is ordering it to. Because something is compressing the vessels in your neck. And here's the part that stops most people cold. That something isn't a tumor. It isn't arterial plaque. In most cases, it's chronic muscle tension. Posture. The position you've been holding for decades without noticing. Before we get to the exercises, there's one preparation step that doubles their effectiveness. Blood viscosity, how thick your blood is, directly affects how easily it flows through partially compressed pathways. Dehydrated blood is thicker. Thicker blood requires more pressure to move through any narrow space. Here's what to do. Every morning, before anything else, drink 300 to 400 milliliters of warm water, not cold, not room temperature. Warm, around 45 degrees Celsius. Warm enough to feel it in your throat, not hot enough to be uncomfortable. Your daily target is simple to calculate. Multiply your body weight in kilograms by 20 to 30 milliliters. If you weigh 80 kilograms, you need between 1.6 and 2.4 liters per day. Why warm specifically? Warm water signals the parasympathetic nervous system to relax vascular walls. Cold water does the opposite. It triggers microconstriction throughout the vascular tree, including in the neck. Take a moment to absorb that mechanism. 25% of your oxygen, one signal from the brain, and the compensatory pressure has been running on autopilot, possibly for years. Now let me show you the first exercise. Reach up and feel the size of your neck. Go ahead, do this right now. Find the 2 thick, cord-like muscles running diagonally from behind your ear down to your collarbone. Those are your sternocleidomastoid muscles. Anatomically, these muscles are wrapped around the bundle of vessels supplying your brain. When they're chronically tight, from stress, from screen time, from years of held tension, they act like a slow, progressive clamp, not cutting off blood completely, just squeezing. Just enough to reduce venous return by 15–20%. Just enough for the brain to say, more pressure, please. Research published in the Journal of Physical Therapy Science confirmed the direct correlation between sternocleidomastoid tension and elevated arterial pressure in adults over 45. The correlation wasn't subtle. It was statistically significant. Here's how to release it. Sit upright, feet flat on the floor. Place your right hand on the left side of your neck, just below your ear. Find the cord of the muscle. You'll feel it more clearly if you turn your head slightly to the right. Now, use 3 fingers to press gently against that muscle. Firm contact, not hard pressure. Slowly turn your head to the left, away from your hand. Stop at about 45 degrees. Hold for 3 seconds. Return to center. Repeat 5 times on each side. The movement should feel like a gradual release, not an aggressive stretch. If you feel any sharp sensation, ease off the pressure immediately. Do this twice daily, morning and evening, not more. The tissue needs recovery time between sessions. If your neck feels slightly tender after that first session, that's a normal response. It tells you the muscle has been holding tension without your awareness. Give it 2 days and that tenderness fades. Now let me tell you about the muscles that almost nobody discusses in a blood pressure conversation. Deep to the sternocleidomastoid, there's a group called the scalene muscles, 3 on each side, running from your cervical vertebrae to your upper ribs. Their primary job is to assist breathing by lifting the ribs during inhalation. But here's what makes them critical in hypertension. The anterior scalene muscle wraps directly around the subclavian artery and the brachial plexus, the nerve bundle connecting to the sympathetic nervous system. When the anterior scalene is chronically tight, it doesn't just compress blood flow. It activates the sympathetic nervous system, fight or flight. And a chronically activated sympathetic system keeps blood vessels in a state of partial constriction around the clock. This is why some people's blood pressure doesn't respond well to relaxation techniques alone. The tension isn't just psychological, it's structural and mechanical. Here's the scalene release. Sit upright. Place your left hand on the right side of your neck, midway between your ear and your shoulder, slightly behind the sternocleidomastoid cord, in the groove between muscle groups. Apply gentle inward pressure with your fingertips. Imagine pressing in toward the center of your neck, not downward. Now, slowly rotate your head to the right, looking over your shoulder. The key word is slowly. Take about 4 seconds to complete the full rotation. Hold at maximum comfortable range for 2 seconds. Return slowly. 5 repetitions each side. Fast movements trigger the muscle to contract defensively. Slow movements allow the tissue to release under the pressure. Quick question, and I'm genuinely curious about this. When you woke up this morning, was there any stiffness in your neck? Even minor? Write a number in the comments. 1 if you felt nothing, 2 if mild stiffness, 3 if significant. I'm tracking this across the community and will share what the numbers tell us. Here's something most people find genuinely surprising. Not all the vessels affected by neck tension are deep. The platysma is a thin, sheet-like muscle covering the entire front of your neck, from your jawline down to your collarbone. It's so thin you can barely feel it separately from the skin, but it sits directly over the external jugular vein, the primary surface drainage vessel for blood leaving the brain. Think of it this way. The internal jugular vein drains the deeper brain structures. The external jugular drains the surface. If the platysma is chronically contracted from stress, cold, habitual forward posture, it compresses the external jugular. Blood backs up slightly. Intracranial pressure rises. The brain responds. When people describe that heaviness in the back of the head that comes with high blood pressure, surface drainage restriction is often a significant contributor. Not the whole story, but part of it. Here's the exercise. Sit upright. Place both hands flat on your chest, just below your collarbones. Apply firm downward pressure with your palms, as if you're anchoring the skin towards your chest. Maintain that hand pressure throughout the movement. Now, slowly tilt your head backward, lifting your chin toward the ceiling. Stop when you feel a stretch across the front of your neck. Hold for 3 seconds. Return to neutral. Repeat 5 times. Now add rotation. From neutral, maintaining the hand pressure, slowly turn your head to the right, trying to look over your right shoulder. Hold 2 seconds. Return to center. Repeat to the left, 5 times each direction. The hand pressure prevents the platysma from shortening as you move. It forces the muscle to lengthen under load, which is precisely how chronic tension releases. Notice how the front of your neck feels after those movements. There's often a subtle warmth. That's increased circulation through vessels that were partially restricted. your body responding immediately. Now, this next technique, I want to be honest with you, raised my own skepticism the first time I encountered it. It looked too simple, but the physiology behind it is actually quite elegant. The tongue is attached to the hyoid bone, a small U-shaped bone sitting in the mid-neck that serves as an anchor for multiple muscle groups, including muscles that directly influence the position of the larynx and the fascial sheaths surrounding the jugular veins. When you rotate the tongue inside your mouth while simultaneously rotating your head, you create a compound movement that mobilizes the hyoid and releases tension in the suprahyoid and infrahyoid muscle groups, structures that pull on the same fascial network as your jugular veins. A study from researchers at Keio University in Tokyo found that combined tongue and cervical movement significantly reduced resistance in internal jugular venous flow in participants with measured cervical tension. The effect was immediate and measurable. Measurable within 3 minutes of the exercise. Not 3 weeks, not 30 days, 3 minutes. That's not a long-term structural benefit. That's acute, real-time physiological change. Here's exactly how to do it. Sit upright. Close your mouth gently. Don't clench your jaw. Begin rotating your tongue in slow circles inside your closed mouth. Large, deliberate circles. Clockwise. Move slowly. About 1 full rotation every 2 seconds. While your tongue is rotating clockwise, simultaneously begin slowly rotating your head in the opposite direction, counterclockwise. Keep the head rotation smooth, within comfortable range. You're not stretching, just moving. Continue for 30 seconds. Then reverse both directions simultaneously. Tongue counterclockwise, head clockwise. Another 30 seconds. 2 to 3 sets, once per day, preferably in the morning. This looks simple. Do it with genuine attention, and you'll feel a change in cervical tension within your first session. If you don't feel anything the first time, check that your head rotation is truly slow and deliberate. Most people rush it. Everything I've shown you so far works on the structural side of the problem, the mechanical compression of vessels, but there's a second mechanism running in parallel, and if you ignore it, the exercises will work at maybe half their potential. That mechanism is your autonomic nervous system. Your sympathetic nervous system, the fight-or-flight system, is a potent vasoconstrictor. When it's chronically elevated, it tells blood vessels to narrow. Every blood vessel, including the ones in your neck. Most men over 50 live with a chronically elevated sympathetic tone. Deadlines, financial pressure, the accumulated weight of decades of responsibility. The body responds as if there's a physical threat. Vessel walls stay semi-contracted. Blood pressure stays elevated as the baseline. The parasympathetic system, rest and repair, is its direct counterpart. And there's a reliable, immediate way to activate it. Controlled breathing that directly stimulates the vagus nerve. This is called box breathing. 4 phases, 10 seconds each. 40 seconds total per cycle. Phase 1. Inhale slowly through your nose for 10 seconds. Count to 10 in your head. Phase 2. Hold with lungs full for 10 seconds. Gentle hold, no straining. Phase 3. Exhale slowly through your mouth for 10 full seconds. Empty your lungs completely by the end. Phase 4. Hold with lungs empty for 10 seconds. Relax your abdomen completely. Repeat the cycle 5 times. Total time, 3 minutes and 20 seconds. Do this once in the morning before the exercises and once in the evening before sleep. If your blood pressure tends to spike in the morning specifically, do it before getting out of bed. The mechanism is direct. Slow, extended exhalation stimulates the vagus nerve. The vagus nerve signals the heart to slow its rate, signals blood vessels to dilate, signals the adrenal glands to reduce output. It's a biological off switch for the sympathetic stress response that you can activate intentionally, anytime. Some people following this protocol find their morning blood pressure readings drop by 8 to 12 points within 2 weeks from the breathing alone. Not a cure, a daily recalibration that compounds over time. Now, stop. I need to tell you something important. And this is the reason I asked you to stay to this point. Roughly half the people who try this protocol will see limited results. Not because the exercises don't work, but because of one specific error in how they apply them. The exercises must be done in the correct sequence. The sequence matters because each muscle group is anatomically layered on top of the next. If you start with the deep scalene work before releasing the platysma and sternocleidomastoid, You're trying to mobilize a deep structure while the superficial layers are still locked. The body resists. You get partial release at best, sometimes increased tension as the muscles brace against each other. The correct order is this. Box breathing first, 5 cycles, to shift your nervous system out of sympathetic dominance before any physical work. Then the platysma, then the sternocleidomastoid, then the scalenes, then the tongue rotation last, as the integrating movement that works across all layers simultaneously. Surface to deep. Nervous system first, always. That's the sequence. There's a second error, and this one is more common. People feel improvement after 3 or 4 days and stop. The structural tension in these muscles built up over years, possibly decades. 3 days of exercises loosens the surface layer. The deeper fascial and muscular layers need 3 to 4 weeks of consistent daily practice to genuinely remodel. The protocol is not difficult. It takes about 15 minutes total, but it requires consistency that most people abandon at precisely the wrong moment, right when it's starting to work. Do the full sequence, in order, every single day for 30 days before forming any conclusions about the results. And there it is, the fatal mistake I mentioned at the beginning. Not a missing supplement, not a wrong technique, sequence and consistency. That's what separates the people who see results from the people who say it didn't work. Tell me in the comments, which of these 5 exercises surprised you most? I want to know because the tongue rotation gets the most reactions. Either people are deeply skeptical or they try it once and immediately feel something shift. I want to know which camp you're in after trying it today. And if this video explains something your doctor never took time to explain, something that actually changes how you understand your own body, then hit the like button. The algorithm decides whether other men in the same situation ever see this information. Every like is a direct vote for this to reach someone who needs it. One final thought. Everything in this video, the exercises, the breathing, the water protocol, these work alongside your current treatment, not against it. If you are on blood pressure medication, do not stop taking it. That is not the goal here. The goal is to give your body the tools to address the underlying mechanical restriction, while your medication manages the numbers in the short term. As vessels decompress, as blood flow improves, as sympathetic tone calms down through consistent practice, many people find their physician naturally adjust their dosage at the next checkup. Not because they asked, because the readings changed on their own. That conversation happens with your doctor, based on your numbers, based on your history. I've worked with patients who followed this protocol consistently. Water, breathing, correct sequence, 30 days, and came back for follow-up appointments with readings that genuinely surprised them. That's the outcome we're working toward. The body is not broken. In most cases, it is compensating. The work is to remove what it's compensating for. Subscribe if you want to continue this work. Next week, I'm covering the specific inflammatory dietary pattern that increases cervical muscle tension from the inside. The connection between chronic gut inflammation and neck vessel restriction that nobody draws because it doesn't look like a heart problem on paper. It looks like a diet problem, but the pressure is where you feel it. See you there.